So we know that H. pylori is a terrible bacteria, very strong bacteria that can survive in the acidic environment of the stomach. It can bind to cells, injects its own proteins into cells and makes the cells ineffective, inefficient, completely deformed and transformed into precancerous cells. But not everybody that gets infected with this bacteria develop peptic ulcers or gastric cancers. So the complications are, in some people, it's peptic ulcers, gastritis, and gastric cancer. Now, the most important question is, how do you actually diagnose H. pylori infection? There is urea breath test, there is stool antigen test, and a biopsy can be taken when endoscopic study is done. For example, if you want to rule out, if the patient has ulcer, or if there's you're looking for a mass, or if you are concerned about GI bleed, for a patient with risk factors who comes in with complaint of abdominal pain and so forth. So what does the urea breath test entail, or how does it work? So you'll be given two bags, and the first bag is you just breathe into it, and they are basically collecting the CO2, your baseline CO2, and then a few minutes later you will drink a solution or a liquid that contains urea, special labeled urea. So you will drink this urea, give it a few minutes. If you remember how the bacteria survives in the acidic environment of the stomach, it takes up the urea, and it uses its own urease enzyme, breaks this urea into ammonia and CO2. And ammonia will neutralize the acid, and CO2 is released into blood, into the environment. But this CO2 is labeled. This labeled CO2 produced by the bacteria will diffuse into the bloodstream and gets to your lungs, and then you'll breathe it out. So after drinking this solution, you will breathe out into a bag, and both of those, the first and the second bag, will be sent to the laboratory. So you have, they have your baseline CO2, and then these special labeled CO2. So that's basically urea breath test. The second test that can be done is the antigen, urea stool antigen. So you're basically looking for parts of the bacteria. And then endoscopy, this is an invasive procedure. If there's indication for it during the procedure, a piece of biopsy can be taken and then be sent to laboratory for pathological study. So now let's say you tested positive. The results came back positive from urea test, or from a stool antigen, or even from the biopsy. How do you treat this infection? So in the past, the recommendation was a triple therapy, a treatment that includes 2 antibiotics, clarithromycin, amoxicillin, and proton pump inhibitors. So the short form, the easy way to remember is a CAP: clarithromycin, amoxicillin, and PPIs. Now the current recommendation, because of the bacterial resistance and so forth, the triple therapy CAP, the professional societies got together and said, stop the CAP. So the triple therapy is not recommended anymore. Now we have the currently approved or recommended treatment plan is bismuth-based quadruple therapy for 14 days. So it includes proton pump inhibitors, medications that decrease acid production, and then bismuth salicylate 4 times a day, tetracycline up to 4 times a day, and metronidazole 3 to 4 times a day. Both antibiotics are 500 milligrams. And as far as mechanism, PPIs work by decreasing the acid production. Bismuth salicylate has several mechanisms. It has antibacterial effect. It disrupts this bacterial cell wall and membrane. It binds to that special enzyme, the urease enzyme, and it precipitates it. It reduces its ability to, the bacteria's ability to break down urea. Basically, it inhibits the bacteria's main survival mechanism. It also has a mucosal protection abilities. It coats the ulcers and gastric mucosa, basically forming a protective barrier against acid. And it also promotes mucus and bicarbonate secretion. Additionally, it helps prevent resistance by lowering bacterial load, making the H. pylori basically more susceptible to the antibiotics. And tetracycline inhibits protein synthesis. Metronidazole is a prodrug. Once it enters the bacteria, it gets reduced into toxic radicals that cause DNA breakage and kind of inhibits or blocks DNA synthesis, so there is no bacterial cell division or multiplication. So the recommendation at the moment is to avoid empiric PPI, clarithromycin triple therapy unless susceptibility to clarithromycin is documented. So let's say you underwent treatment for 2 weeks, and how do you actually confirm that the treatment worked? How do you evaluate the effectiveness of the treatment? So 4 to 6 weeks after completing the treatment, you can still do urea breath test or the stool antigen test. So you can repeat those tests, urea breath test or urea stool antigen test, in 4 to 6 weeks after completing the treatment. So 4 weeks before the test, you are required not to take any oral antibiotics or oral bismuth salicylate or Pepto-Bismol. So 4 weeks before doing this eradication confirmation test, you are required not to take any antibiotics to avoid getting false results. And then 2 weeks before the test, you are required not to take any prescribed or over-the-counter antacids or PPIs. And then for urea test, 1 hour before the test, you are required not to take any food, or you are required not to eat or drink anything, including water. So basically NPO.